Welcome to the FINE lecture series. On behalf of the Perinatology Research Branch of NICHD and the National Institutes of Health, my name is Lami Yo, and I am one of the developers of FINE. In this lecture, we will briefly discuss the anatomic box tool, which is part of the FINE method. Anatomic box is used to mark 7 anatomical structures of the fetal heart within the stick volume. We previously reviewed the tool known as stick loop developed by our team and which is used to determine if a stick volume is appropriate before applying the FINE method. As a reminder, one should observe at least 2 scrolling cycles. This is cycle 1 and now cycle 2. The stick volume shown here is appropriate because it has met all the criteria using stick loop. This includes the last criteria, which is evaluating the sagittal plane for motion artifacts. After the stick volume has been determined to be appropriate, the next step is to mark anatomical structures of the fetal heart within the stick volume using the anatomic box tool. And once marking is completed, this triggers intelligent navigation technology. By identification and selection of key anatomical landmarks, the system will generate a geometrical reconstruction or model of the organ of interest, such as the fetal heart, and then automatically navigate, find, extract, and display specific planes, in this case, 9 standard fetal echocardiography views for the FINE method. The user marks 7 anatomical structures of the fetal heart within the stick volume using anatomic box. The 7 structures are the aorta at the level of the stomach, the aorta at the 4-chamber view, crux, right atrium wall, pulmonary valve, superior vena cava, and the transverse aortic arch. The anatomic box panel is on the right-hand side of the screen. This video shows the marking procedure. First, the aorta at the level of the stomach is marked. Next, the aorta at the 4-chamber view, the crux, right atrial wall. Next, the pulmonary valve is marked. Then the superior vena cava, and finally the transverse aortic arch. Within several seconds after the last structure has been marked, FINE will automatically generate and display 9 fetal echocardiography views, and we refer to these views as diagnostic planes. And they are the 4-chamber view, 5-chamber, left ventricular outflow tract, short axis view of the great vessels or right ventricular outflow tract, 3 vessels and trachea view, abdomen, stomach, ductal arch, aortic arch, and finally the superior and inferior vena cava. Here is an artistic representation of intelligent navigation of the fetal heart. 7 structures are marked by the user in sequence. Next, an internal geometrical model of the fetal heart is generated, and then the system will automatically navigate through the model, find, extract, and display specific cardiac planes, such as the 4-chamber view, the aortic arch, 3 vessels and trachea view, and the ductal arch. 4 planes are shown here, but of course FINE will depict 9 planes. Now in the next lecture, we will discuss in detail how to actually mark the 7 anatomical structures of the fetal heart using anatomic box. But first, we want to discuss how FINE simplifies the marking process for the user. This is accomplished in 5 ways: 7 labeled buttons, 7 reference images, Find will automatically scroll to the plane that needs to be marked, predictive or intelligent cursor placement, and the cardiac phase is recognized and controlled automatically. We will now discuss each of these in more detail. The first is 7 labeled buttons. Anatomic box provides 7 labeled buttons. Each label describes the anatomical structure to be marked, and after each structure is marked, the system sequentially allows the user to mark the next anatomical structure in the image. In this image, please notice the unchecked button labeled crux. This means that the crux is the next structure to be marked. 2 anatomical structures, the most recent being the aorta at the level of the 4-chamber view, have already been marked as indicated by the 2 check marks next to the labeled buttons. 7 reference images. There are 7 reference fetal heart images for each labeled button. These images are from a reference fetal heart and not from the actual fetus being examined. Their only purpose is to teach users how to mark. Find allows only the relevant reference image to appear when marking the depicted anatomic structure. Find teaches the user the 7 cardiac structures that need to be marked and also where the marking should occur through reference images. To repeat again, they are the aorta at the level of the stomach, the aorta at the level of the 4-chamber view, crux, the right atrial wall, pulmonary valve, superior vena cava, and the transverse aortic arch. In this example, the pulmonary valve is supposed to be marked next. Therefore, a reference image of the pulmonary valve is shown to the user. The reference image teaches the user to mark the middle of the closed pulmonary valve. Note that this reference image is not taken from the actual fetus being examined. Find automatically scrolls to the plane to be marked. The marking process is simplified for the user since the system will automatically scroll through the stick volume to the plane of the most likely location of the anatomical structure to be marked. However, due to variability in fetal and cardiac anatomy, the user may need to manually scroll to the correct plane for marking. These are usually minor adjustments, however. In this example, the next structure to be marked is the pulmonary valve. Therefore, a reference image of the pulmonary valve and where to mark is shown. From the stick volume, Find will simultaneously present the view of the fetal heart that corresponds to this reference image. If this is the correct plane, the user will mark on this image. Here, Find is automatically presenting the plane to mark the pulmonary valve. Predictive cursor or intelligent cursor placement by intelligent navigation technology. Now, Find does not place the cross-shaped cursor anywhere on the screen. Instead, Find simplifies the marking process because it automatically places the cursor near or at the location to be marked. Predictive or intelligent cursor placement occurs for the last 4 anatomical structures to be marked: the right atrial wall, pulmonary valve, the cross-section of the superior vena cava, and the transverse aortic arch. We have described predictive or intelligent cursor placement in a recent publication by our team entitled New and Advanced Features of Fetal Intelligent Navigation Echocardiography, or 5D Heart. Now, another feature that may not be obvious is that during the marking of anatomical structures, the cardiac phase is recognized and controlled automatically by FINE. Why is this an important feature? When FINE recognizes and automatically alters the cardiac phase, this facilitates marking of anatomical structures, for example, the crux of the heart and the pulmonary valve, and this is an important feature to increase the success of obtaining fetal echocardiography views. So here is an example. The tricuspid and mitral valves should be closed. In other words, the systole phase of the cardiac cycle, so that the user can mark the crux of the four-chamber view. FINE closes these valves automatically for the user. Please notice, however, that if the valves are open in diastole as shown here, the user cannot determine the location of the crux to mark it. Similarly, to mark the pulmonary valve, the valve must be closed. In other words, the diastole phase of the cardiac cycle. If the valve is open in systole, there is no pulmonary valve visible to mark. Therefore, FINE knows this and will automatically close the pulmonary valve so that the user can mark this valve. In conclusion, 7 anatomical structures of the fetal heart within the stick volume are marked using anatomic box. This will generate a geometrical reconstruction of the fetal heart that is internal. 9 fetal echocardiography views will then be automatically generated and displayed. FINE simplifies the marking process for the user in several ways. 7 labeled buttons, 7 reference images. FINE will automatically scroll to the plane to be marked. There is predictive or intelligent cursor placement. And finally, the cardiac phase is recognized and controlled automatically. Thank you for your attention.